an example, and let's see how can we make a decision about the use of media on course objectives. Suppose that we have to teach the 4-unit nursing care about diabetes mellitus. The objectives of these units are: number 1, explain the pathophysiology; number 2, identify the assessment to be done on the diabetic patient; and number 3, write a teaching plan for a newly diagnosed type 2 diabetes mellitus and evaluate the nursing care provider for a diabetic patient. First, in discussing pathophysiology, here we can use an overhead transparencies and explain the pathologic chain of events. The second one is assessment. Assessment can be taught by means of lecture. The third one is the teaching plan. This teaching plan can be best, it would be possible to assist each student in writing teaching plan. So we can ask the student to form a group and contribute to a teaching plan. And finally, we can show a video tape of a nurse who is caring for a diabetic patient recovering from ketoacidosis and plans to have the student evaluate care given by the nurse. The second factor to consider in deciding the media is the ability of both materials and media support, or technical support rather, level, ability, and number of learners, of course. And technology should be never used simply because they fill time or make it easier for teachers to entertain the learners. But if the educational objectives can be met in an entertaining way. And lecture and discussions can be broken up with some audio visuals to provide